Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of December 21st. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has 42,655 cases, and there are 587 deaths. These numbers continue increasing at an alarming rate. Oakland continues to be hit the hardest, and our East Oakland zip codes continue to have the highest positivity rates and case rates in the entire county. The 94601, 94621, and 94603 zip codes have positivity rates of over 13%, which is triple the county rate of 4.2%. Now let's take a look at hospitalizations, which continue to increase at an alarming rate. This line just keeps going straight up like never before. As of Monday, December 21st, we had 359 COVID patients in the hospital. We have not seen this many COVID hospitalizations in Alameda County ever. And this is my third week in a row saying the same thing because the number just keeps climbing. In fact, we've been breaking the single day record every day for over 2 weeks now. And we also have broken the record for number of ICU patients with COVID-19. And we are now at 100 people in the ICU with COVID-19. Remember, our previous peak was in July at 213. Now we have surpassed that by far at an all-time high of 359. When will it peak and start coming back down? We do not know. So right now, the best thing we can do is cancel those holiday plans, do not gather, shelter at home, mask, and distance if you must go out. And now I'd like to share what's going on at our COVID testing site on 99th and East 14th. As you can see here, the positivity rate, or the percentage of people who tested positive compared to the overall number we tested, is climbing significantly week over week. And as long as cases keep climbing, we unfortunately expect hospitalizations to keep climbing as well. We typically see the impact of increased cases in our hospitals after about 2 weeks. So when will it peak and start coming back down? Again, we have no idea. So right now, the best thing we can do is cancel those holiday plans, do not gather, shelter at home, and mask and distance if you must go out. We have received many questions on the topic of vitamins and supplements. This has been an evolving topic, so today I'm going to share our best knowledge and thinking at this time. There are a lot of studies going on trying to figure out if vitamins and supplements are useful in preventing COVID-19 infections or reducing the severity. Now, we know that the best tools we have to combat COVID-19 are to shelter at home, and if you must go out, mask, distance, wash your hands, and don't touch your face. And of course, we have the vaccine, which is on its way to all of us and will be the most important tool. But is there anything else we can do? First off, if you are not sheltering, masking, distancing, and washing your hands, then you might as well just stop listening now. Please don't waste your time thinking that a vitamin or a supplement will help you if you are not doing these things. And it certainly won't help those around you. So, for those of us who are sheltering, masking, and distancing, is there anything we can take to protect us? Well, there's not much of any conclusive evidence yet that is specifically about vitamins and COVID-19, but there is a lot of promising information out there, and there are things you can and should do. And as I said, there are many studies underway, so we will continue to keep an eye on those. So, can supplements help our immune system? Well, there are several vitamins and minerals that are required for normal immune functioning. So what you don't want is to be deficient in any of those nutrients. On the other hand, too much of some vitamins and minerals can actually be dangerous. So the greatest benefits of supplementation is really when you are deficient. But how will you know if you are deficient? Well, most people won't know if they are or not. But also, most Americans do not get the recommended allowances of all their vitamins and minerals. Our diets don't tend to have enough variety of vegetables, fruits, and whole grains and tend to be processed to where we lose many of the nutrients. Ideally, everyone would get all of their vitamins and minerals from an excellent and balanced diet, but unfortunately, all too often, this is not the case. A deficiency in one or more essential nutrients can absolutely reduce your immune defenses. But this is not one of those situations where if some is good, more is better. Quite the contrary. Overdosing on vitamins and minerals can make you feel ill, and some of them can even have serious consequences like toxicity. One way to fill nutritional gaps without overdosing is a daily multivitamin, multimineral supplement, and I will talk about that more in a bit. So now let's get into some specifics. First, what about herbs and teas and such? This is not my area of expertise, and I'm not going to pretend that it is. I like ginger and turmeric just as much as the next person, but I am not under any illusion about those things helping to prevent my getting sick with COVID-19. Whole garlic cloves, bone broth, kale, goji berry, green drinks, I love them all, and I do partake myself. These things are healthy, they contain antioxidants, they're not harmful, and they make you feel good, which is a benefit in and of itself. So I say have at it. But I really want to talk about a short list of supplements with the most promise and under the most investigation as it relates to COVID-19. These are vitamin C, melatonin, zinc, and vitamin D. Vitamin C, also known as L-ascorbic acid, is a vitamin that we cannot make in our bodies, so it is an essential dietary component. We know that vitamin C is an antioxidant that does support the immune system, and it also helps to prevent inflammation. COVID-19 causes a profound inflammatory illness, and that inflammation is what is wreaking havoc on so many organs in the body. It's not just a respiratory disease. Vitamin C has been studied in everything from low doses by mouth to high dose IV infusions. Some studies say it reduces the duration of a common cold, and others seem to refute that. But vitamin C does interfere with the inflammatory process, and it is an antioxidant. So I would not want anyone walking around with a vitamin C deficiency, especially right now. Oranges, red peppers, and strawberries are great sources of vitamin C, and that multivitamin I suggested will also give you enough vitamin C. Too much vitamin C will make you feel pretty bad, so please don't go over 2 grams a day. Melatonin. Melatonin is actually a hormone that our bodies make naturally. It gets triggered when it's dark, and it signals the body that it's time to go to sleep. Some people take it as a sleep aid. Sleep is very key to a healthy immune system. Losing sleep for even one night can increase your risk of getting sick if you are exposed to a virus, because you produce less proteins called cytokines and also antibodies that help you fight inflammation and infection. Melatonin production reduces with age, and we know that the older you get, the higher risk you have of doing poorly with COVID. There are some very interesting studies about melatonin and how powerful it is both as an anti-inflammatory and an antioxidant. Evaluation of a large set of data from the Cleveland Clinic, just published this past November, linked melatonin supplements to a 28% reduction in the likelihood of testing positive for COVID. And among African Americans, the reduction was 52%. This is a very interesting finding that they got from basically mining through and analyzing their own data. We'll need some studies in order to say anything conclusive about this, but it is promising. As I mentioned, melatonin is produced naturally, and the best way to encourage it is to be in bright and natural light for at least a couple of hours a day. That way, when it gets dark, your body will sense the difference and make melatonin naturally. You can also take melatonin supplements. It's important to note that even though melatonin is considered a supplement in the United States, it is a hormone, and in some countries it is treated as a drug or medication. Like I mentioned, it makes you sleepy, so it should be taken before bed, and if you take too much, it can make you sleepy when you need to be awake. You can start at a half milligram and go up slowly to 1 to 2 milligrams with no more than 5 milligrams per night. Higher doses can cause serious side effects and can also interact with other medications, so please check with your doctor before taking it. Zinc. Zinc is a mineral that does help the immune system to fight viruses and bacteria. Zinc has long been thought to shorten the duration of a cold if you take it at the first sign of any symptoms. There's not much evidence about zinc in COVID, but like vitamin C, it's one of those things where you do not want to be deficient. The amount you need depends a lot on your age and stage of life, with some of the higher doses being required for pregnant and nursing moms. Most of us get enough zinc in our diets, and some foods like cereal are even fortified with zinc. Those who may not get enough zinc in their diets are vegetarians, as well as those who consume a lot of alcohol. Most likely, though, you are getting enough in your diet, but if you take that multivitamin I suggested, you will get enough zinc. Too much zinc can actually be quite harmful. It can cause other deficiencies as well as nerve and blood disorders. So go carefully with this one and look up the recommended daily allowance for your age and stage of life. I have saved what I think is the most important and most promising for last, and that is vitamin D. Vitamin D is a vitamin that is found in a few foods, and it's a vitamin that our bodies produce as well. Vitamin D promotes our bodies to absorb calcium, so we know it's important for bone health. But it's also important for our immune function and for reducing inflammation. A systematic review of 24 different studies looking at hospitalized patients showed that the risk and severity of acute respiratory tract infections were worse with those who had less vitamin D and better with more vitamin D. And this was published in 2019. Now, with COVID, there have been studies from all over the world trying to establish a link between COVID and vitamin D deficiency. It has been shown that those hospitalized with COVID have a much higher incidence of vitamin D deficiency, but we don't know yet if one causes the other. We don't know what's the chicken and what's the egg. People with vitamin D deficiency also appear to do worse with COVID, but again, we don't know if the underlying reason is the deficiency or not. There was also a small study that actually tested the effectiveness of giving people with COVID vitamin D. And those who got vitamin D did indeed do better than those who did not. But this study was small and will need a more comprehensive study to say anything conclusive. There is absolutely no question that those with vitamin D deficiency should receive supplementations. With all of these lines of evidence, I also believe that vitamin D is by far the most promising supplement as it relates to COVID-19. As I mentioned, we make our own vitamin D. When the sunlight hits our skin, we actually make vitamin D in the skin. So the amount you make will depend on how sunny it is, what time of year it is, how cloudy or smoggy it is, how much you go outside, and how much pigment is in your skin. Now, that part is important. The darker your skin tone, the longer it takes you to make vitamin D. We have more recently started to realize just how common vitamin D deficiency is and have started to do more routine screening for vitamin D deficiency by blood tests. But it's estimated that 35 to 40% of U.S. adults are probably vitamin D deficient, and the rate is almost double in African Americans. That is right, an estimated 76% of African Americans are vitamin D deficient. With this prevalence of vitamin D deficiency out there, I suggest that first, the next time you're going to have your blood drawn, ask your doctor about screening for vitamin D levels. And second, I think it is perfectly reasonable and safe to take vitamin D supplements. There's not total agreement on how much supplementation is needed. The recommended daily allowance is 600 IUs, or international units. But you need more than that to get you out of the deficient zone if you are deficient. 2,000 international units is safe, whether you're deficient or not. and would get most people out of the deficiency zone unless you are severely deficient. If you're severely deficient, you may need up to 4,000 IUs. It is important to note that too much vitamin D can be toxic. It can interact with other medications. It can actually have an opposite effect on your bones, making you more susceptible to a fracture. Also, keep in mind that if you take a multivitamin, it will likely have vitamin D in it, but probably not enough. So please take the amount in your multivitamin into account. Try to get some sunshine and supplement from there. Now, here's our best advice one more time. Please stop gathering. Make other plans for these holidays. If you must check on a loved one, wear a mask, space out, make it brief, and make it outdoors if possible. Take a multivitamin supplement each day and consider additional vitamin D supplementation. Check with your doctor if you are pregnant, nursing, on chronic medications, or if you already have COVID-19. Shelter indoors as much as you can whenever you can, but only with members of your household. Don't share your air. Mask up, space out, protect your elders and those with underlying conditions. If you think you were exposed, isolate yourself. Get tested in 5 to 8 days and continue to isolate until you get your results. I'm going to repeat this. If you think you were exposed, isolate yourself. Get tested and continue to isolate yourself. We are calling too many positives who were with someone who got tested, then hung out with them, then got their results, then called them to tell them they were positive. If you got tested, that means you probably suspected that you might be positive. Please do yourself and everyone around you a favor and isolate yourself. If you have symptoms, do not go to work, do not gather. Isolate yourself, get tested as soon as you can, and isolate until you get your results. Once again, if you have symptoms, please don't blow it off as something else. We're calling too many positives who said, oh, I just thought it was a cold. I went to work the first couple of days and then I got tested. Please don't just think it's a cold. Please don't go to work. Isolate yourself, get tested, and wait. That concludes today's People's Health Briefing. Please submit your questions in the chat, by direct message, or by email to admin@rootsclinic.org. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.